Hi, welcome to my CRPS YouTube channel. I'd like to introduce myself. My name is Nancy. I'm a wife of 46 years, a mom of 2 girls, and grandmother to a boy and a girl. I have had CRPS, complex regional pain syndrome, for 28 years. It started with a car accident. I am a nurse, and I was driving home from opening a home care case in Philadelphia when a 19-year-old distracted driver made a left turn into the front of my vehicle. From that time forward, I knew something was desperately wrong. I'd never broken a bone before, but I knew I had then. So I was taken by ambulance to a hospital that I used to work in. They did x-rays. Yes, I had fractures. They gave me a shot of Demerol, put a splint on, and sent me home with crutches. Told me to get in touch with an orthopedic surgeon that week. So when I got a hold of the orthopedic surgeon, he wanted me to have a CT scan of the foot. The CT scan showed that I had 8 crushed fractures in the middle part of my foot. So after a week of keeping it elevated, trying to get the swelling down, he put me in a cast. I was non-weight bearing for 8 weeks. And then he put me into a boot and eventually a MAFO, which is a molded ankle and foot orthotic. And there'll be pictures of these things at the end. So I began to feel what I knew was nerve pain, shooting and burning pain in my foot. My orthopedist wrote down all these symptoms, followed by, but I don't think she has RSD. And in 1996, that's what they called CRPS, reflex sympathetic dystrophy. I was not aware that he wrote that in my chart until much later when I got my medical records. So fast forward to 1998, and I was still having burning pain, shooting pain, and extreme pain that should no longer be there as the fracture had healed. The orthopedist said, well, I think you have traumatic arthritis. And he recommended doing surgery to fuse my foot, which involved 5 screws being put into the middle part of my foot. Well, that was adding insult to injury. And things just got worse from there. I will talk about my diagnosis and treatments when we get to those shows, but I just wanted to welcome everyone and tell you a little bit about myself. Thank you. Hi. Today we're going to talk a little bit about treatments for CRPS. Today we're going to do an overview, and in the next 7 shows we will go into detail of each of the types of treatment. Many people choose their healthcare provider based on the treatment that they offer. All treatments should do the following. They should reduce your symptoms. You should choose the most effective reduction of symptoms with the least amount of side effects. And you need to weigh benefit versus risk. So, for example, in an invasive type of treatment, you have to look at, will I get good enough pain reduction in order to deal with potential side effects of surgery. There are a variety of CRPS treatments to choose from. There's no right or wrong treatment for everyone. We are all individuals, and CRPS affects us slightly differently. Treatments all affect us all slightly differently. It's a good thing to poll other people with CRPS, see what treatments they've had and how they've benefited from that treatment. Do research, look up articles peer-reviewed on the different treatments to see what the success rate is. So over the next 7 shows, we will go into detail of each treatment that is available. Some of the treatments I have personally had and others I have not. For those that I have not experienced or had a bad experience with, I will be interviewing guests who have had the treatment with a good result. First, will be sympathetic nerve blocks. This goes back into time when it was thought that CRPS simply affected the sympathetic nerve symptoms. But if you go back and remember centralization and you go back and review glial cell activation, we now know that CRPS is not only affecting the sympathetic nervous system, but it affects the entire central nervous system. We will talk about spinal cord stimulators. This is a surgically implanted device that sends electric waves into the spinal column. Ketamine infusions. They can be inpatient or outpatient. And we will talk about the protocols that have helped others. Hyperbaric oxygen chamber. This is one I have not done. And we will talk about how having high amounts of oxygen can help to improve your symptoms. Physical therapy, either as a primary treatment or in conjunction with another treatment. Intrathecal medication pumps. These can be used with things like baclofen for people who have spasticity or have movement disorders, or it can be used with a pain medication such as morphine. A scrambler used to be called Calmari. It's now called scrambler therapy. And we will speak with someone who has firsthand experience. Then we will talk about other IV medications, such as nedronidate, lidocaine on its own, and other IV medications. And finally, we will talk about medications by mouth. Low-dose naltrexone, opiates, gabapentin, medical marijuana, and more. So I hope you will stay with us in the coming weeks and learn more about the different treatments available to those with CRPS. Thank you.